very good evening to all of you. And I must apologize that I am not present in person as I'm not there in the country. I'm out of country. But nevertheless, I would like to thank Scleroderma India Foundation for giving me and inviting me for this talk. It's a real honor for me. It has always been. I've been very closely associated with the Scleroderma India Foundation since its inception. Today, I'm going to talk about the heart in scleroderma. And I think that's a very, very important topic. So as you know that scleroderma is a disease which can affect multiple organ systems. The cardiac manifestations of disease are diverse, and only recently it is recognized that the heart is a major organ involved in scleroderma. So up till now, we have been talking about skin, we have been talking about lungs, kidneys, but heart is a major organ involvement in scleroderma, and this has been recognized of late. And the presence of cardiac involvement generally portends a very poor prognosis for patients, and that is why it's very important to understand and suspect and pick up this condition early. In fact, most of the recent studies have suggested that the clinical evidence of heart disease or myocardial disease may be seen in 20 to 25% of patients with scleroderma. Now, before going any further, I would like to take you briefly through the anatomy of the heart. It's important to understand that. So there are different layers of the heart, and any of these layers can get affected in scleroderma. So that's something we need to understand. So these layers from out to inside is, so you have the pericardium, which is like a sac which is covering the heart, inside which the heart is pumping and moving. And this sac has an outer layer and an inner layer. And in fact, there is a small bit of fluid which provides lubrication to this heart, and the cavity moves. And then you have the muscle layer or the myocardium, and the internal layer or the endocardium. So these are the layers. So when we talk of heart diseases, either there's a direct effect on the heart, which is you can have a disease of the pericardium or the pericardial sac. You can have a disease of the myocardial disease or the muscles of the heart. And you can have a disease of the inner side of the heart, which involves the valves. And you can have involvement of the whole heart in form of involvement of the heart channels. And when we talk of indirect effects, we talk of effects on the heart indirectly by effects on the lung through interstitial lung disease and pulmonary artery hypertension. And as we go forward, I'll explain you as to how these lung conditions can ultimately affect the heart and also the kidneys. So these can indirectly affect the heart. So let's now go to the heart. Now we have the pericardial involvement. So if this is the heart, so you can see this pericardial sheath, which is like a sac around the heart, this green thing. And then it has a outer layer, and then it has an internal layer. And between the two layers, the blue and the green, you have this fluid, which is called the pericardial fluid or the pericardial cavity. Now, this fluid is very minimal in normal people. And as you can see again on the right side, you have the pericardial sac, the outer layer and the inner layer. And between this fluid is there. But there are conditions where this sac can get inflamed or swollen, and that can lead to chest pain. And sometimes there can be huge accumulation of fluid around the heart in this sac. And that fluid can constrict the heart, and sometimes be very life-threatening. So on one hand, we have pericarditis, which is inflammation of the sac. And on the other hand, you have pericardial effusion, in which there is a lot of accumulation in the fluid. And once this fluid gets accumulated, it prevents the heart from contracting properly. And this is in fact one of the most common involvement of heart in most of these scleroderma patients. And this often can present mainly as chest pain, shortness of breath. It's very important to recognize this condition, and I'll tell you why later on. The next is, of course, the muscle layer of the heart and the myocardium. And this is very important for one major reason, is that this is the layer which contains the conductive system of the heart. So the conduction system is like a wiring of the heart, an electric wiring, where you have a generator from where the electric impulse comes, and then it goes to the different chambers of the heart, and that is how the heart contracts. So this wiring is present in this layer, and any involvement of this layer, either by inflammation, which we call as myocarditis, or fibrosis. As we know, in scleroderma, there is fibrosis everywhere. There is fibrosis in the lungs, there is fibrosis in the GI tract, there's fibrosis in the skin. Similarly, there can be myocardial fibrosis, and this fibrosis can interrupt this electrical conduction system. And when this electrical conduction system is interrupted, it leads to irregular beating of the heart. The electric impulses don't travel properly, the heart doesn't beat. Either it beats very fast, something we call as tachycardia, or it beats very slow, something we call as bradycardia. So it can lead to irregularities of the rhythm. And it's very important to recognize some of these conditions. As we know, on ECG, you have a regular heart rhythm. And when some of these wirings go haywire, you can have a very fast beating, which can be known as tachycardia. It could be supraventricular tachycardias or ventricular tachycardias. And very important to recognize these things because they can lead to sudden arrest of the heart. So conduction system gets involved very frequently in scleroderma. And then you have the inner layer, the endocardium, and the valves. So sometimes you can have valvular abnormalities. What are these valves? So you have a valve between one chamber and the other chamber. The upper chamber and the lower chamber on the left side is called as the mitral valve. And the lower chamber and the upper chamber on the right side, which is called the tricuspid valve, and the lower chamber and the pulmonary trunk, the pulmonary vessel, which is called the pulmonary valve. And then you have the left heart chamber, lower chamber to the aorta and its branches, which is the aortic valve. So they are different valves. And sometimes they can also get affected in scleroderma. It can lead to floppiness, and these valves can become lax or very tight. So when they become lax, they lead to regurgitation, or the fluid kind of leaks back. And when they are tight, it can lead to obstruction for the outflow of the fluid. So all of these things can cause various problems to the heart. So we know that there are heart chambers. So as I told you, there's the left heart chamber, upper chamber, and lower chamber, known as the left atrium, left ventricle. And there's a right heart with the upper chamber as the right atrium and the right ventricle. And each of these chambers connect with each other through these valves. So you can also have chamber defects because of the valve, because of various other things, and this can lead to either a left heart failure or a right heart failure or a combined failure. So let's talk about the right heart failure, which is in fact a very important uh, component in scleroderma. And what happens is, as you see from the right heart, the blood which is impure goes into the capillaries and into the lungs, and from the lungs, this impure blood gets oxygen, becomes red, and then it comes back into the left side of the heart, from where it flows to the rest of the body. So you see, the lung plays a very, very critical role in this process of putting oxygen into the blood from the right side of the heart and then putting it to the left side of the heart. This whole thing happens here. And if this exchange is not happening properly, or there is some damage to the lungs, as we shall see, then there can be a pressure on the right side, and this can lead to right heart failure. Right, so this is the right heart, and the blood is going, the deoxygenated blood is going to the lungs, and there in the capillaries, it gets oxygenated and goes to the left side of the heart. So in the right side, if some of these vessels, the precapillary pressure goes up and there is fibrosis, it can lead to something we call as pulmonary artery hypertension. So once there's a pulmonary artery hypertension, and these are the pulmonary arteries, this can cause back pressure on the heart. And this back pressure on the heart can lead to enlargement of the right side of the heart and failure of the right side of the heart. Similarly, if you have interstitial lung disease, when you have interstitial lung disease, these small capillaries which are supposed to provide oxygenation, they get obliterated. And as a result, there is back pressure on the heart on the right side, and there is right heart failure. Then there is something known as PVOD, which is a rare condition known as pulmonary veno-occlusive disease. And this is usually in the post-capillary area. And once there is fibrosis of this can again lead to failure of the heart. So hence, any involvement of the lung in form of interstitial lung disease can cause pulmonary hypertension and failure of the right heart. And pulmonary artery hypertension per se can also cause backflow and pressure on the right heart and cause it to fail. So what is right heart failure? Right heart failure is something which is very commonly seen in scleroderma patients. It leads to basically loss of appetite, and because of the backflow blood, it leads to swelling of the lower legs and leads to huge swelling in the legs and weight gain known as the leg edema. So this right heart failure is very important to recognize, because this tells you that there is some problem with the right side and probably because of the lungs or the pulmonary arteries. So right heart failure, the signs can be very subtle: weight gain, fatigue, fluid, not only in the lower legs, in severe cases also in the stomach. The stomach can get distended because of fluid, so fluid accumulation in the stomach and the lower legs. Enlargement of the organs like liver and spleen. There can be loss of appetite. So all these things can cause or are signs of right-sided failure. So if you have these signs in a person of scleroderma, one must, especially leg swellings early on, can be a sign of right heart failure. Similarly, you can have left-sided failure. Left-sided failure is much more dramatic because the left heart plays a very important role in pumping the blood into the circulation. So any left-sided failure can lead to shortness of breath while movement, and it can be confused with a lung problem, whereas the lung may be normal and it's a heart problem. It can lead to shortness of breath in an upright position. It can lead to coughing at night. You can wake up at night because of shortness of breath. And patients who have left heart problem, they're not able to lie down, something we call as orthopnea. So when they're lying down, they get shortness of breath because the fluid gets absorbed and goes to puts the pressure on the left heart, and they start getting breathless. So they would sleep at night and typically wake up in the night because of shortness of breath, which is known as PND, or paroxysmal nocturnal dyspnea, which means intermittent episodes of shortness of breath at night. It can also cause something called as palpitations. So you can have feeling of fast heart rate, or you can feel your heartbeat. It can lead to fatigue and tiredness because the heart is not able to pump blood into the periphery. So the organs are not receiving enough oxygen, so they get tired and fatigued. So left-sided heart failures, as I told you, it can lead to restlessness, confusion, shortness of breath on lying down, fast pulse rate, bluish discoloration of the tongue, central discolorations at times. It can lead to paroxysmal nocturnal dyspnea, which I explained you, which is like waking up, episodes of waking up in the night because of shortness of breath. It can cause cough, constant cough and wheezing, and sometimes even blood in sputum. So all these things, as you see, are very, very similar to lung involvement. And very often one can miss these signs of left heart disease and confuse them for lung involvement. And that can happen because this is underlooked. And that can also happen because this can sometimes coexist with the lung disease. So it becomes very important to understand that whether the lung is the problem or the heart is the problem. And as I told you, the signs of heart failure are: you would get swelling in the legs, you would get shortness of breath, you would get palpitations. So these are signs that the left heart is failing. Apart from this, there's a very fascinating condition which happens in scleroderma patients, and this is known as the coronary Raynauds, the Raynauds of the heart. So similarly to Raynauds, which we all know happens in the distal vessels of the fingers, which constrict on exposure to cold. Similarly, the blood vessels which are supplying the heart, sometimes they can also undergo a spasm in reaction to various triggers. And this can lead to a very severe heart attack kind of a situation where there is severe chest pain, and it almost mimics a heart attack, except that there is no cholesterol deposition here happening. But what is happening is that the coronary arteries are undergoing a spasm. So it's a Raynaud's of the heart. And this can be often a cause of distress and recurrent admissions in patients of scleroderma because of chest pain, mimicking a cardiac involvement or a heart disease. And the problem is, when we see the angiography and other things, nothing comes out and everything seems to be normal. So as I've explained you, The heart is an under-recognized organ which is involved in scleroderma. It can often mimic a lung condition and therefore get confused as a lung disease. There are various layers of the heart. You have the outer layer of the pericardial sac. This can get inflamed, causing chest pain, which is known as pericarditis, or there may be fluid along this, which can lead to chest pain and shortness of breath. And then you can have the involvement of the muscle layer, which can cause disturbance of the conduction system. And subsequently, you can also have the involvement of the inner layer of the valves, and the various chambers of the heart can fail. So what are the investigations for this and how we can pick this up? Of course, for the pericardial disease and the myocardial disease, we all know that a 2D echo, which is a very simple bedside ultrasound kind of a technique, where we can just scan with a simple probe and look whether there's fluid in the lungs, whether there is involvement of the myocardium by myocarditis, whether the heart is properly functioning or not. And also by a simple X-ray, if there's a huge pericardial effusion, huge fluid around the heart, it can be picked up on a normal X-ray also. How to look at whether the wiring system has gone wrong? The ECG is one of the best methods. You can see a normal rhythm, and where there's a conduction abnormality or involvement of the electrical system, wiring, you will get abnormal impulses on the ECG, and we can pick that up. Involvement of the muscle of the heart can also be nowadays seen with the cardiac MRI, which is an advanced imaging which can pick up inflammation of the heart, which can also pick up fibrosis in the heart. And whether the heart is getting properly perfused by blood or not, that can also be seen by something called as thallium perfusion imaging. This is a nuclear imaging where we can look at the scan and it can show us whether this particular radioisotope, which is tagged, can be picked up. Its flow is normal in various parts of the heart. So the heart's functional ability, whether all the parts of the heart are properly contracting or there is some problem in a focal area, can be picked up by this thallium perfusion imaging. And of course, we have the conventional angiography also, which is less required in scleroderma patients. And sometimes we can also pick up by some newer modalities. We have the CT angiography, but angiography by and large is more useful when there is a long-standing disease and you develop cholesterol deposition. But most often it's normal, and what you are actually having is a coronary vasospasm known as the Raynaud's of the heart. So how do we treat these conditions? So if you have a pericardial disease, there is pericarditis, you give steroids or you give anti-inflammatory medication, the inflammation subsides. If there's a minimal amount of fluid, giving steroids will reduce. So this is the only condition in scleroderma where you would give high-dose steroids. No other disease other than this, and muscle involvement perhaps. For lungs, you would never give high-dose steroids. But I would repeat that pericardial effusion is the only condition where you would require high-dose steroids. And if sometimes it's very huge, you need to do a tap and put in a needle and take out the fluid. That will reduce the pressure on the heart, and the heart will function normally. When there are conduction defects and you have this electric wiring going haywire, we have drugs to correct this, known as antiarrhythmics. And if that they don't correct, then we do something called as radiofrequency ablation. If there's a chamber problem, the one chamber is failing, we have medications for heart failure. For right side, we have medications to reduce the load. For left heart, we have medications to increase the contractility of the heart. If there is pulmonary artery hypertension, which is causing a backflow and failure, we give medications for pulmonary artery hypertension, and I'm sure that we discussed. And those medications would indirectly also affect or improve the right heart. And dear friends, with that, I will leave you with this final slide, a very dear patient and friend whom we all remember, and because of which we are all here today, because of whom we are all here today. Neetu, we will all miss you always. And I think you have left a big void. You are the most dynamic person I have ever seen. And you've touched 1 million lives and will continue to touch 1 million lives. And we will always miss you. And I would dedicate this talk today to your loving memory. And I'm sure you would have been so involved and so happy to have seen Scleroderma India Foundation really evolve and help so many patients today. With that, friends, I leave you with that thought. Thank you.